Communication with patient dealing with anxiety.
Hello everyone, this is group 4 and we're going to be doing a presentation on communication with patients with anxiety. Anxiety is feeling unease. It's having fear of unknown. So some patients are afraid to die. Some patients are afraid that they might not get healed from the disease that they are having. Some patients have anxiety with injection, and that's the presentation that we are going to be doing. A patient who is scared or afraid of injection.
Poor handling of an anxious patient.
Hello? Yo, you're so funny. Hey, okay, bye-bye. What's your name?
Florence.
Florence. What's your name?
Maganga.
Speak louder.
Maganga.
You were here last week. What are you here to do?
I'm still not feeling well.
Every week you don't feel well. Every week. Okay, we're going to give you an injection today.
Please don't.
Oh no, we don't have time for this.
Please don't. I'm afraid of needles.
Florence, I don't have time for this. I'm going to call my supervisor.
Poor handling of an anxious patient can increase their distress, feeling misunderstood. They may become more anxious, experience physical symptoms, and not follow medical advice. Insufficient communication and lack of empathy worsen the problem. Proper handling of anxious patient.
Hello. How are you?
I'm good.
What's your name? Good. Okay.
What's your name?
My name?
Yeah.
My name is Florence.
Okay, nice to meet you, Florence. Okay, I will take a blood sample from you.
No.
Why?
Mhm.
Are you anxious of needles?
Yes. I hate
Okay,
needles.
it's okay. It will be a small procedure. It's not gonna hurt. Trust me, it will not hurt you, I promise. Okay, tell me more about you.
What do you want to know?
Okay, what's your favorite color?
My favorite color?
Yeah.
It's purple.
Okay, don't look at the needle.
Okay.
Okay, what do you study?
I'm studying. I don't even remember what I'm studying.
It's okay, we're finished right now. Are you done?
Proper handling of anxious patient can significantly alleviate their distress and foster a sense of trust and safety. Effective communication. Empathy and patience are crucial in addressing both emotional and physical need by taking time and listen, validate their feelings, and explain procedure clearly.
Alright, some signs to look out for when you have an anxious patient are fast breathing, failure to sit still, trembling, restlessness, and sweating.
Nurses have different interventions that they can use to deal or manage patients with anxiety. A nurse should first identify if the patient has anxiety, e.g. the patient might be sweating, uneasy, or trembling. These are signs that a patient is suffering from anxiety.
Another intervention that a nurse could use is trying to create a safe and comfortable environment for his or her patient. The nurse could also ask the patient personal questions, e.g. asking what they had for dinner, their favorite colors, or what are their favorite activities.
A nurse can also manage the anxiety by using music, altering the environment, asking questions, games.
And lastly, the other thing that a nurse can do is teaching the patient how to handle anxiety, e.g. telling them to take deep breaths when they feel like they're being anxious.
These are incorrect measures to take when handling a patient with anxiety. First of all, being rude to the patient. Secondly, not listening to the patient. Thirdly, not giving the patient listening ears and safety.
These are the correct measures that a nurse should take when dealing with anxious patients. For example, a nurse should not listen to patients, but instead keep them to aid and try to reassure them.
Hi, I'm going to talk about the summary on how to do with anxious patients. This first video scenario showed us the poor handling of communicating with an anxious patient, while the second video you saw how the nurse greeted the patient, how the nurse did everything. That was the proper way of handling an anxious patient. We also talked about the signs and symptoms of this anxious patient or someone with anxiety. We also talk about the measures or the interventions of as a nurse that you give to your patient that has anxiety. First of all, you have to calm them down. You have to give all these, maybe identify the risk factors or the factor that causes them to be anxious, and you have to calm them down. You have to do so many things. You have to also introduce them to the skills that they know how to do better and things that will calm their anxiety level down.
When interacting with an anxious patient, remember these key points. Listen actively, show empathy and let them speak. Stay calm, use a soothing tone. Be clear, use a simple language, avoid jargon. Use nonverbals, maintain eye contact and open body language. Encourage, question, invite and address their questions. Reassure, provide comfort about their care and safety. Build trust, be consistent, reliable and respectful. Your effort makes significant difference in patient care.